Hello, YouTube. I think you're there. This is the third time trying to get live with you for today's episode of Jimmy Rants. It does look like it's here to stay this time, you guys. So Facebook is already here. Vegans must be running YouTube, says Kira. Oh, Kira, you have no idea who's running YouTube. It's a lot of interesting people, let's put it that way. All right, I'm very late now to my show, Jimmy Rants, so I've got to get started over on Instagram. So let me get this show on the road. Thank you all for being here. Be sure to share it here on Facebook. You can share it on your personal page or on pretty much any group page that you are. What's up, Ted Naiman? Thanks for being here as well. Got a great couple of studies here looking at type 2 diabetes and low-carb diets. So really excited to share this information. All right, here we go. New research shows that a ketogenic diet is best for those with type 2 diabetes. Find out the details today here on Jimmy Rants. JimmyRants.com is the website. Click on that little box down there in the corner. It'll take you straight to IGTV for today's episode. We are here on Instagram, so you got to go follow me there if you want to watch this show, Jimmy Rants. It's on Monday through Friday, 11 a.m. Eastern time, and we have a really good time, you guys, trying to present all kinds of information. But you got to go follow me. Instagram, Livin' Low Carb Man is my username, LIVIN, Once you're there, engage live, again, Monday through Friday, 11 a.m. Eastern. We also simulcast over here on my Facebook page where Cindy and Mary just popped in to watch today's show. And we also have our YouTube streamers. So thank you all for being here today on Jimmy Rants. If you miss a live, you can watch it on replay over on IGTV right here on Instagram. We also throw the past episodes up over on YouTube. Just type in a keyword Jimmy Rants. You'll find the show. Finally, you can find literally every video I've ever done for Jimmy Rants over at the official website at jimmyrants.com. And while you're there, if you like what we do here, be sure that you click on the Patreon link, and any donation of any amount would definitely help keep us on the air. Try not to have any ads on here, and truth be told, you guys, I would love to go to just Patreon and not have any sponsors ever again. Unfortunately, there's not enough people that support my work for me to be able to do that. So if you want me to be free of all ads on all my podcasts and everything I do, definitely help out with the Patreon link. And if it gets to the point where I can be sustained paying my bills with that, then I will get rid of all my sponsors. So how about that? Yeah. All right, so today, you guys, I have some exciting news because you may or may not know that behind the scenes, there is a whole lot of research going on in the world of type 2 diabetes as it relates to low-carb diets, ketogenic diets. And lots of ongoing research, some of which are going long-term. A lot of ketogenic research especially tends to go, if it's considered long, it tends to go 6 months or 1 year, and very, 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 very rarely 2 years. Well, it was about 3.5 years ago that Dr. Sarah Hallberg, Dr. Steve Phinney, Dr. Jeff Volek, and a group of researchers all said, you know what? We need to prove the efficacy of a low-carb ketogenic diet for controlling type 2 diabetes over the truly long term. You know, because the argument is, and has always been, well, we know that glycemic control on a ketogenic diet is good for up to 1 year, but we don't know what happens after 1 year, as if the benefits that you get in 1 year on a ketogenic diet for type 2 diabetes control suddenly just disappears after 1 year. But that's the way it's been portrayed. And so Virta Health, which was a joint venture by Dr. Volek and Dr. Phinney and Dr. Hallberg and many other doctors, they decided that they're going to do a 5-year study looking at the effects of a low-carb diet for patients with type 2 diabetes. And they wanted to see how it would go. Well, guess what, guys? They are now 3.5 years in to that study. And I've talked about it before, some of the preliminary results of the previous years, they're doing well. And I've got new information. It was 1 year ago that there was a 2-year data finding in Frontiers in Endocrinology. That's where it was published. And then Virta recently published new data from the study as a supplement in the Journal of the Endocrine Society, which I have a copy of right here. And in there, by the way, it's the Journal of the Endocrine Society 2020, and the title of the paper, A Continuous Remote Care Intervention Utilizing Carbohydrate Restriction, Including Nutritional Ketosis, Improving Markers of Metabolic Risk, and Reducing Diabetes Medication Use in Patients with Type 2 Diabetes over 3.5 years. So, all the participants who completed 2 years of being on the ketogenic intervention were offered the opportunity to take part in year 3. Of the 169 people who were in the study for 2 years, 143 or 85% of them decided to stick with the study longer. Now that should be telling, because if they went on an intervention and they were told, okay, it's a 2-year study and you'll have the option to continue after 2 years, and it sucked and it wasn't providing benefit and they weren't enjoying it anymore, don't you know they would have had a dropout rate higher than 15%? But a whopping 85%. A lot of these diet studies, you guys, those people drop out long before, like the original was 2 years. They would have dropped out long before if it wasn't providing them some pleasure, some benefit in their diabetes. They wouldn't. So compared to the baseline, so 3.5 years ago, they did a baseline on all these patients to see what their markers were when they started. And remember, this is a study of type 2 diabetics. So all of these patients are type 2 diabetics, and they wanted to see what a ketogenic diet would do for them. So their average HbA1c, hemoglobin A1c, which is a key blood sugar marker, was reduced by 0.6%. That's really, really good. 71% of all diabetes medications other than metformin were discontinued. That's amazing. Like, getting off of medications should be the goal of most doctors. Unfortunately, a lot of doctors, they put them on these medications and they expect those patients to take them for life, never once looking at why do they need to continue to take medications. Could it be something they're eating? Yes, is the point. Because when you remove the carbs from the diet, their diabetes gets better and they come off of medication. 71% in this study. 22% of the participants achieved total remission of their diabetes, meaning that their HbA1c was less than 6.5% and they have maintained it for at least a year. That's huge, you guys. 1 in 4 were able to get their diabetes into full remission. Now, it depends on the severity of the diabetes. Some people have this condition called type 1.5 diabetes, where their pancreas has pretty much petered out and slowed down to the point that they will probably always have to be on medication, always have to maybe take a little bit of insulin because that kind of type 1.5 diabetes. But if you're a new type 2 diabetic, or you haven't seen this progressive amount of damage take place over years and decades in your life, you could probably go into full-on remission of your diabetes. Does that mean you're cured of your type 2 diabetes? No, it's still there, but you can manage it properly by keeping your carbs low and eating a ketogenic diet. The average weight loss over the period of time was 24 pounds. Keep in mind, this was not a weight loss study. It's a type 2 diabetes management study. So they're looking at blood glucose, looking at insulin levels, and those kinds of things. Weight loss is just merely a byproduct of controlling those things. And then triglycerides declined by an average of 41 milligrams per deciliter, which again, one of the telltale signs that you're doing keto well is your triglycerides will drop. And they've shown that in this study, that the average drop is 41 milligrams per deciliter. So this was a supplement to the journal rather than the full paper, and they will provide more evidence when they come out with their full paper, probably for year number 4. They will go ahead and put that paper out. But I think that summarized most of the findings that they had in here. See if there's anything else in the actual paper. So the ongoing trial will assess 5-year effects of a ketogenic diet on type 2 diabetes. So this, you guys, is great, great news. And it's not the only one. I have another study here, hot off the presses as well. This is from the British Medical Journal. This is a pretty long one, so I hope I can get through most of it. I'm going to try to skip around so I don't delay, but effects of the low carbohydrate, high fat diet on glycemic control and body weight in patients with type 2 diabetes, experienced from a community-based cohort. This is from the Johns Hopkins School of Medicine. And so prior studies indicate that a low-carb, high-fat diet has the potential to improve glycemic control and results in the reduction of glucose-lowering medications. The new findings in this study, to our knowledge, this is the very first study to date that investigates the implementation of a low-carb, high-fat LCHF diet in a community-based setting, making the results generalizable and applicable to the clinical practitioner. So they did it within a community-based setting, meaning that you had a whole bunch of people all getting the same information, teaching-wise, and kind of being looked at accordingly. And so that's interesting because a lot of the online world, that's what it relies on, is community-based setting. Think about like all the Facebook pages, for example, that are dedicated to diabetes. And you go on there, or even keto in general. You go on there and you get support for that specific subject. That's what they're talking about here. Our study shows that it is feasible and safe to implement the low-carb, high-fat diet in the real-world community real-world setting among patients with type 2 diabetes, and this diet may offer superior glycemic reduction along with greater weight loss compared with the usual care over 3 months. And here's the thing. Has anybody ever asked the question why a low-carb diet offers superior glycemic reduction? Like, to you and I, that seems like common sense. Duh. What's raising the blood sugar? It's the sugars and the grains and the starches in people that are metabolically unhealthy. And remember, we're talking about type 2 diabetics, not someone who's insulin sensitive, not someone who's an elite athlete, not someone who has a normal metabolism. Sick people with insulin resistance to the point that it's turned into type 2 diabetes. Why is it a great revelation that a ketogenic diet would be superior in offering glycemic reduction? To me, that's a well duh, with what we know and how it impacts the blood sugar and how the body of an insulin resistant person, a type 2 diabetic person, doesn't quite respond in the same way to those carbohydrates. It's a lagging response. Think about it, if your fuel filter starts to get clogged in your car, it makes your car run kind of funky, right? You start to kind of feel sluggish. It might start knocking, and you kind of go, okay, what's going on? Something's wrong in there. And when you change out the fuel filter and you put it in, all that together, I'm not a car expert, but the point is when you fix the problem that's the underlying issue, then the car runs better. That's how you go from insulin resistant to insulin sensitivity. If you still have insulin resistance, it's that filter all clogged up. Therefore, when you eat carbohydrates, it's not going to make your body function very well. Okay? All patients following the low-carb, high-fat diet in this study who initially took insulin had either a reduction of or discontinuation of this therapy by their healthcare provider when clinically indicated, compared with less than a quarter of those who got the usual care. Again, they got a discontinuation or a reduction eating keto. And again, we should ask the question, why? Could it be that insulin's purpose in their diet and in their diabetes management was solely to cover up the effects of the carbohydrates they were eating? If you are a type 2 diabetic who takes insulin, ask yourself this question. Why are you taking insulin? It's not a trick question. And I'm not talking about metformin. I think if you're a type 2 diabetic, metformin's probably one of the better drugs out there. I'm talking about shooting yourself with injectable insulin. Why do you do that? And would you like to come off of that? Because if you're taking injectable insulin as a type 2 diabetic, you already make enough insulin. Your problem isn't an insulin problem. Your problem is what you're eating that's raising your blood sugar problem. And yes, the insulin you're injecting yourself with will cover up the effects of those carbs by lowering your blood glucose. But how about you remove the thing that's raising your blood glucose to begin with? You eliminate that injectable insulin, all under the care of a doctor, of course. and then you fix the problem. And that's what they're finding in these studies. And if you joined us late, we've got a couple of research papers here confirming that if you have type 2 diabetes, a ketogenic diet, a low-carb, high-fat diet is actually the best way to go to control the disease and even reverse it and put it in remission. So how might these changes or results change the focus of research or clinical practice? For motivated patients, the low-carb, high-fat diet should be considered as a viable treatment for type 2 diabetes. And we've seen this already. Last year, the American Diabetes Association finally got on board and recognized that a low-carb diet should be a part of the options for people with type 2 diabetes. And the only reason that happened, you guys, I've been out here 15 plus years banging the drum that type 2 diabetes definitely needs a low-carb diet. And the ADA kept saying, no, low-fat, eat healthy whole grains, take your insulin, shut up already. Okay, but it took a type 2 diabetic on a low-carb diet to become the president of the American Diabetes Association for them to finally change. And I sure hope to God someday somebody at the American Heart Association has heart disease, went on a low-carb ketogenic diet and improved it. I sure hope that happens because we desperately need better information coming from these organizations that pretend like they are for helping the people that they're on the cause for. So American Diabetes Association, people that have diabetes. American Heart Association, people with heart disease and had a heart attack and blah, blah, blah. And keep in mind, lest you forget, I remind you often on Jimmy Rants, but lest you forget, diabetes, type 2, heart disease, PCOS, some cancers, Alzheimer's disease, obesity, all of these things, you guys, are the exact same disease. Let's never, ever forget that. There is no heart disease. There is no diabetes. There is no PCOS. There is no Alzheimer's. It's all insulin resistance. Okay? If we start looking at this in terms of insulin resistance, then we can stop micromanaging all the manifestations of that insulin resistance. Fix the insulin resistance and you fix all of these issues that we're talking about. Now, these studies specifically look at type 2 diabetes, but can you imagine if research finally got with the program and realized all these diseases are the exact same disease, they're just manifested in different ways, and you actually started treating the insulin resistance? How far would we come? How far would we go? How much chronic disease could be fixed if you looked at the underlying thing that's making all of them happen? The unfortunate thing is you have diabetes care, you have heart care, you have women's health care, you have brain health care, you have all these different categories, and it spreads out this disease, this big gigantic disease that covers all of them, of insulin resistance. I'm looking forward to the day that maybe there's a medical practice that opens up and says insulin resistance healing, and that would be the name of the practice or the theme song of the practice. And you come in, and regardless of the chronic health issue you're dealing with, they're fixing the insulin resistance. Now, obviously, they're going to help you with the specifics of if your blood sugar's out of control with the diabetes, or if you're starting to have heart palpitations and things for the heart. They'll have little specialists on hand to be able to help with the specifics, but the overriding theme would be getting you on a diet and lifestyle program that would heal insulin resistance and make you more insulin sensitive. How cool would that be, you guys? I sense that's coming inevitably in the future. So future research questions from this paper. What patient characteristics are predictive of greater levels of glycemic reduction utilizing the LCHF diet? So what is it about a patient that will predict that they'll have great reduction? That's an interesting question to ask for research. What are the long-term effects of a low-carb, high-fat diet on cardiovascular risk in patients with type 2 diabetes? And I just explained, when you have diabetes, type 2 diabetes, you probably have a propensity, and you do, for heart disease as well. What are the long-term effects? Of course, they're still worried about the saturated fat. We've done several Jimmy Rants recently about saturated fat really not being a big issue of concern anymore. What is the optimal proportion of carbohydrates in the low-carb, high-fat diet for weight loss and cardiovascular benefit? So in other words, how low do you go Does everybody need to go super low? I will tell you my thoughts on that. I think you go as low as your body tolerates. Again, if you have insulin sensitivity, you could probably get away with having as high as maybe 100, 150 grams of carbs in your diet if you're insulin sensitive and you're active and you're utilizing those carbs appropriately. Where it's not going to be good for someone to go that high in the carbs is when you have insulin resistance and you need to go 50 grams or less, and some people well below 50 grams or less, probably 20 grams or less, or maybe even zero carbs a la carnivore. That's when you would get the benefit. But I don't think it's going to be this across the board. Everybody needs to do that. And so how do you help people figure out what that proportion of carbs should be in their diet? That's what they want to look at in future research. And then finally, is the low-carb, high-fat diet sustainable in the real-world setting over the long period of time, over 1 year? And what I just said with the Virta Health study, the reason they are doing a 5-year study is because all these questions always come up. Well, we don't know what's going to happen after a year. We know it shows great results up to 1 year, but we don't. The day after 1 year is up, okay, they all go back up again. No. We don't really need that. But those studies are already happening. All right, so let me skip around a little bit and get to the nitty gritty of this. All right, so the study designed for this specific study, and again, I'm reading from the British Medical Journal. This is a new study that just came out looking at type 2 diabetes and the effects of a low-carb, high-fat diet on glycemic control and body weight, looking at a community experience cohort. So a retrospective analysis of electronic medical records was conducted comparing glycemic and other metabolic outcomes in patients who were on a low-carb, high-fat diet for at least 3 months, compared with patients who got the usual diabetes care. Their primary outcome was the change in A1C from the baseline and to their follow-up visits. Participants had 4 different visits. Number 1 visit was the baseline. Visit 2 was between 6 and 11 weeks. Visit 3 was between 12 to 16 weeks. And visit 4, 17 to 21 weeks. They also looked at all these secondary outcomes, including a change in your body weight, body mass index, the BMI, FPG, LDL, HDL, triglycerides, ALT, SBP, and DPB, which is your blood pressure markers. And then they followed up at 12 weeks. Total body weight was measured with patients lightly clothed without any shoes on. BMI was calculated. Blood pressure was measured with a cuff. All blood tests were obtained after an 8-hour fast by LabCorp or one of the other big labs. The participants were identified from the Johns Hopkins Community Physicians, Downtown Bethesda, and Germantown endocrinology practices from extraction of electronic medical records between January 1st, 2015 and April 30th, 2018. They had to have been diagnosed with type 2 diabetes. They had to be overweight, defined as a BMI over 25 kilograms per meter. Pregnant patients and those with stage 4 or 5 chronic kidney disease were excluded. The Lchf Group consisted of patients who were referred to by an endocrinologist, advised to go on a low-carb, high-fat diet, and chose to do it, and then would complete 3 months or more of a follow-up. The UC group consisted of patients who did not consult the medical bariatric specialist, whether they were referred or not, and who received UC with at least 3 months of follow-up. Okay, so the people in the ketogenic wing of this, they knew they were in trouble. They were recommended by their doctor to try a low-carb, high-fat diet. They wanted to try a low-carb, high-fat diet. And the reason I bring all that up is I think it's important when it comes to compliance, the person has to want to do it. Like, it's one thing to tell people, yeah, a ketogenic diet's best for those with type 2 diabetes. But if someone says, ugh, I think I could eat meat and eggs and cheese and non-starchy fat, I don't think I could do that. How likely are they to stick with it? Not very. But if you've got someone with a disease, you've got a doctor saying, hey, you should probably try a low-carb, high-fat ketogenic diet, then they agree, yeah, I would like to try a low-carb, high-fat ketogenic diet. You are golden to think that they could stick with this for at least 3 months to see how it goes. So that was key. The study team engaged with the core for clinical research data acquisition to query clinical data for the patient cohort, blah, 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 blah. Okay. Patients that were placed in the low-carb, high-fat diet group were instructed to bring a food log or a list of regularly consumed foods, including all drinks and snacks, to their first meeting with the bariatric physician. Patients were educated by the bariatric physician on the importance of carbohydrate metabolism and the role of insulin in lipogenesis and weight gain in simplified terms. Can you imagine if we could get doctors to explain in simplified terms what lipogenesis means, what ketogenic, what ketosis, nutritional ketosis means, what having blood ketones and beta hydroxybutyrate means, and why carbohydrate restriction is at the heart of it all? This is the breakdown in why type 2 diabetics are not being taught well, because they're not getting this information anywhere except from lugs like me who teach it and do it in educational simplified language. I often get criticized by people. Oh, Jimmy Moore, he acts like he's smart because he just dumbs everything down. He's not very smart. You know how hard it is to read things and know and can follow along on a complex level, and then to be able to translate that into usable language that people understand? It's a little harder than you think it is. You might want to try it before you knock it. But no, I can follow along pretty well, deep in science. My gift and what I try to do is translate that science into usable language, because if the patient is not understanding, all the science in the world ain't gonna help. It's one reason why I think Keto Clarity did so well. In case you have not seen it, let me grab it here. Keto Clarity, probably my most well-known book is Keto Clarity. And basically what it is a simplified version of how ketogenic diets work. And the reason I wrote that book, and all my books really, was to make it easier to understand. And that's what they did. They had these bariatric physicians explaining in simplified terminology what all of this means. Patients were recommended to restrict their net carbs to less than 20 grams a day, or about 5 to 10% of their total calories, whichever was lower. The daily recommendation for protein was 20 to 25% of total calories based on their sex, physical activity level, and their ideal body weight. Recommended total fat intake was 65 to 70% of their total calories. Permitted foods and beverages include meats, poultry, fish, eggs, low-carb nuts and seeds, non-starchy vegetables, high-fat dairy products, sour cream, heavy cream, cream cheese, hard cheese, plain full-fat yogurt, fats and oils like olive oil, which, remember yesterday I gave you a warning about olive oil. Not all olive oils are the same, so be sure you get one with one country of origin. You get good quality olive oil. Butter, coconut oil, and beverages such as water, unsweetened tea, and coffee. So they gave all of these study participants in the low-carb group sample meals, snack options, and recipes, and they provided all those online to them on a whim. Patients were also advised to only eat when they're hungry and to avoid eating late at night. No calorie restriction was imposed whatsoever. All the patients were recommended to drink at least 6 to 8 glasses of water a day, and they were encouraged to keep a food log either on paper or using MyFitnessPal. Food logs were reviewed at subsequent visits to monitor the adherence to the diet. So, as you can see, they're really going out of their way to set these people up for success. And I wonder, out loud, how many of these diet studies that they do they go to that much length to make sure that the people are set up for success? I have heard of some studies, you guys, no lie. They'll put them on the low-carb, high-fat diet, and they give them one sheet. And they say, okay, here you go. And the sheet isn't really explanatory, doesn't really go into great detail. Pretty much the people are left to their own devices. And when you leave people to their own devices, they're going to default to things they just know are true. And a lot of them end up like spontaneously cutting fat because, well, we know lowering fat is a healthy modality, so we're going to do that, and we know it all, blah, 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 blah. So I love the design of this study. Before they started the low-carb, high-fat diet, patients were recommended by an endocrinologist to discontinue all of their type 2 diabetes drugs and to reduce their insulin by as much as 50% so they don't go into hypoglycemia if they're taking those medications. This is why if you are a type 2 diabetic and you're taking medications and especially insulin, don't go keto without the help of a doctor, because they have to adjust your medication. So they preempted that. They told them to discontinue use of sulfonylurea drugs. I think that's a drug that actually helps with the glycemic control. And so they get them off of that because they know keto will do that for them. And same with insulin. They reduce their insulin by 30 to 50% because they know if you don't reduce the insulin, you will go into hypo. And then the person's like, man, this keto sucks. I go into hypoglycemia. It had nothing to do with that. It had everything to do with the insulin. Patients in both groups were offered a prescription for phentermine to aid in weight loss. So phentermine kind of is an appetite suppressant. So they offered that and they felt like they would need one. The funny thing is, if you start eating keto, about 3 days in, you're like, wow, I'm not hungry at all. So you don't need that. All patients were encouraged to check their blood glucose at home at least once a day, preferably in a fasted state, and keep a log of that. Those on multiple day insulin injections were asked to check their finger stick blood glucose prior to meals, and at bedtime, patients on insulin were asked to return to the clinic 2 weeks after the initial visit so that they could adjust the insulin, and all other patients returned within 2 to 4 weeks. All the follow-ups were basically 1 to 3 months and decided on individually by the bariatric physician. So the other group, not LCHF, they were encouraged to eat all these high fiber foods like vegetables, fruits, whole grains, legumes, low-fat dairy, fresh fish, and foods low in saturated fat. They were offered standard counseling regarding diabetes self-management and medication adjustments. In other words, the standard diabetes diet and advice was given to them. Patients in both the groups were advised to increase their physical activity to at least 30 minutes a day in 1 or more sessions. The importance of adequate sleep was also emphasized for weight management, and the patients were told get at least 6 to 8 hours of sleep a night. Okay, so they set up all of that for both groups. So how did they do? Sample size calculations were based on previous data, assuming the same number of patients in the LCHF and UC groups. At least 48 people were needed in each group. Let me skip ahead a little bit because we are kind of running short on time, but they wanted to look at all of these different markers and how they compare. So the results, 49 people in the low-carb, high-fat group and 75 people in the UC group. Although groups were matched for age, the low-carb, high-fat group had a slightly younger mean, 57.3 years old, than the UC group, which was 63.1 years old. All right, let's see if I can get to the main part here. Significantly more patients in the low-carb, high-fat group elected to use the phentermine to aid in the weight loss. However, in regression models that adjusted for age, sex, BMI, and duration of diabetes, no significant difference in their A1C was found between patients who took the phentermine versus those who did not. So in other words, the drug was more a psychological thing for them to take it. It didn't really provide any benefit, but maybe it gave them the psychological effect that they were doing something that would be beneficial. Like, ask the average person, okay, you can go on a ketogenic diet to help with your type 2 diabetes, or you can go on a ketogenic diet and we'll give you this drug that is shown to help with weight loss. Who's going to turn down the drug? Not many. Most people want to lose as much weight as possible. All right, so the LCHF group had a reduction or discontinuation of glucose-lowering medications. That's predictable. And then compared to the UC group, the two groups had similar proportions of patients on insulin therapy at the baseline. All patients in the low-carb, high-fat group either had an insulin discontinuation, which was 37% of them, or insulin dose reduced, which was 63%. You combine those two, 100% of them at least lowered their need for insulin. Huge. By contrast, of the UC patients, the usual care, taking insulin at baseline, only 5.1% were able to discontinue their use. 5.1% compared to 37%. Huge. 18% had insulin dose reduction by the end compared to 63% of the keto group. 41% had no change. And get this, 36% of the standard care had to increase their insulin. More than a third of them had to go up in insulin, continuing on with the diabetes diet. Now, riddle me this, Batman. If the diabetes diet is requiring more than a third of your study participants to have to take more insulin, wouldn't you say it's something in their diet that would be causing them to have to take more insulin? Remember, they were taking insulin coming into this, and they had to increase it on the standard diet. Whereas in the ketogenic group, nobody increased their insulin. Every single 100% of them either discontinued or greatly reduced their amount of insulin. That there alone should be the take-home message of this here study. And we need to be shouting this from the mountaintop, because how many people are following that healthy whole grains and lots of fruits and vegetables and cutting down on saturated fat, and their diabetes is getting worse? To me, if increasing your insulin dose in almost 40% of your study participants, increasing it on the standard diabetes diet, that should be your telltale sign that that's the wrong diet. Why don't we try the diet and put everybody on the diet that, gee, I don't know, nobody sees an increase in their insulin? Am I just out on a limb here? Like, this seems like it's so elementary, stupid easy. Why isn't keto pushed hard as the diet, the very best diet for people with type 2 diabetes to control their insulin or get them off of insulin altogether? Among those initially on this therapy, the medications were discontinued by the provider in all of the low-carb, high-fat group patients to prevent their hypoglycemia. By contrast, only 12% were able to discontinue the medication. In other words, 88% of the ones on the usual diet had to keep taking diabetes medications on top of having that extra insulin as well. 88% compared to none. None for the low-carb, high-fat group. Like, is this not stark? If this doesn't, like, nail a hammer hard into the usual care for diabetes when it comes to the diet they should be consuming, I don't know what will. Overall, 12.8% of those in the low-carb, high-fat group initially taking metformin discontinued, compared with only 3.9% of the people on the usual care diet. Within the low-carb diet group, many patients also discontinued the use of these DPP4 inhibitors, 22% of initial users, SGLT2 inhibitors, 10.5% of initial users, and the GLP-1 agonists, the 43% of initial users, whereas not one single UC patient who took any of these medications were able to get off of them during the follow-up visit. None. Let this sink in, guys. You got any type 2 diabetes people in your life? You better darn well be sending them a copy of this Jimmy Rants today and let them see it and hear it loud and clear. You're on that diet because you're told it's the healthy way to eat. You're on that diet and you're reinforced by doctors and the American Diabetes Association and all these groups and dietitians telling you that you should eat lots of healthy whole grains. You should eat lots of fruits and vegetables. You should cut down your saturated fat. You shouldn't eat red meat. You shouldn't eat dairy. On and on and on. And look what studies are actually showing are happening to the patients on that diet. And it ain't good. And yet, if you go on a ketogenic diet, it's very good. The data don't lie. And I hope you're hearing this very loud and clear. So in the study, they analyzed a cohort of patients with type 2 diabetes who were managed in a community-based practice. The results demonstrate that participants who went on a low carbohydrate, high fat diet had far superior glycemic reduction, looking at the A1C compared with those who were on the usual care. This finding was found to be significant at the very end. The improved A1C was accompanied by a significant 11.9% reduction in body weight. Nearly half of the patients discontinued insulin a few months after starting low carb, high fat. By contrast, patients receiving the usual care had no significant change in their glycemic control. In other words, if they came in with an average 120 blood glucose, guess what? They left with an average of a 120 blood glucose. Did not get better. Non-significant changes in weight. Their weight didn't change. Keto group, yep. But not in the usual diabetes diet. And increased insulin doses stayed high. Our study adds to the growing evidence that supports a low-carb, high-fat diet in the treatment of type 2 diabetes, further demonstrates its effectiveness in a real-world setting. Our results are consistent with prior studies reporting a significant reduction in A1C, blah, 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 blah. All right, so let's keep going. So the mechanisms for the improved glycemia observed with the low-carb, high-fat diet include, they're saying this is why they got better, okay? Listen to this. Why did the blood glucose get better? Dietary carbohydrate restriction was the key. To me, this is the one thing that I've never understood about diabetes care from like mainstream health professionals. Why can we not get that it's the carbohydrate stupid, to coin a phrase from the early 90s? It's the carbohydrates that are raising blood sugar in all forms, even the healthy whole grains, even the fruits that all are so beloved, they're natural. Yeah, they're naturally raising your blood sugar. Even all of those foods that are supposedly virtuous, they're real food. Oh, okay, they're real food. Okay, yeah, they are. But they're not healthy for you if you have type 2 diabetes and you're trying to control blood sugar. Lessening the need for endogenous insulin secretion. This is the thing too. When you don't eat the carbohydrates that are raising blood sugar, insulin does not get stoked. And if the point is we're trying to control insulin in a type 2 diabetic so that the pancreas can have a break, any food that would raise insulin would be counterproductive. And what's the major food that raises insulin? It's carbohydrate. It's protein to a very minor degree, but it's primarily carbohydrate. As well as exogenous insulin administration, as well as resulting in subsequent weight loss. By following a low-carb, high-fat diet, restricting carb intake, plasma glucose levels decrease, and overall insulin levels are reduced as well, allowing for fat burning, lipolysis, to take place, and the use of non-esterified fatty acids as an alternative fuel source, talking about beta-hydroxybutyrate for blood ketones. Overall, a mild state of physiological ketosis is induced, and the reduction in hyperglycemia, which is high blood sugar, occurs often within days of starting low-carb, high-fat, long before significant weight loss is observed. So sometimes people go on a ketogenic diet with diabetes, and they're like, oh my gosh, I'm not losing any weight, and it's been like 2 weeks or whatever. But then you say, well, how's your blood sugar? Oh, my blood sugar came in a perfect line. Oh, it's wonderful. And I'm like, is that not a benefit? They get discouraged because the weight loss isn't happening, but they're not seeing that healing is taking place on the inside because their blood sugar has come down. Lowered blood sugar, lowered insulin, lowered inflammation levels. Eventually the weight loss will catch up, but people want that weight loss because that's what they've been told to look at. But a whole lot more interesting is you've got your blood sugar under control. All right, I think I have hit most of this study. Let me see if there's anything else interesting in here. The bottom line is that they have shown that there is real efficacy in a ketogenic diet for type 2 diabetes. And again, this is old hat for us here on Jimmy Rants. You've heard me talk many times about how it's silly that we don't already have keto being the standard of care when it comes to helping people with diabetes. But the research world is what's going to talk to a lot of these medical professionals that go to conferences and hear about this kind of research, and that's when change takes place. So you as a patient may know about this many, 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 many years before your doctor does, which is why it seems so perplexing when you find out about this stuff and then you go to your doctor and they don't have a clue. They won't have a clue for 5 to 10 years. So you're ahead of the curve. The problem is, why don't they have a clue? If a layperson like Jimmy Moore can find these studies and talk about them and see them and see that they're well designed and they've got good efficacy, why can't your doctor do a PubMed search and find these things? The problem is they can, they just don't have the time, they don't have the energy, and they have a little bit of that I'm the doctor, you're not syndrome. Not all of them, but a lot of doctors do. And they don't like it that a patient seems to be more educated than they are on things. So that kind of hits their ego the wrong way. Our study has some important limitations. Let me go over this. First, other factors may have contributed to the differences in A1C. Notably, since this was not a randomized study, the LCHF patients were self-selected, may have been more motivated. Okay, they're more motivated, but that doesn't mean that the validity of what they got with the study results is any less fascinating. And I would hope anybody that goes into a study looking at a diet change, that they're motivated for whatever that diet change is. This further underscores the potential benefits of healthcare providers discussing low-carb, high-fat as an option to their patients. The low-carb, high-fat patients also had a lot more face-to-face time with a healthcare provider due to the recommended bi-monthly and monthly visits with the bariatric physicians. About half of the low-carb, high-fat group elected to start on the phentermine, which may have impacted their weight loss. However, the A1C was similar in those who did not use phentermine, so we don't know if it's statistically significant. Future long-term studies to gain further metabolic insights into the diet are needed, including verification of nutritional ketosis with blood or urinary ketones while following the diet. So apparently they did not do that. Of course, I have this little device that tests for breath ketones, which is a clinical device as well. So I think there's a lot of opportunities there. So we have great potential to reduce glucose-lowering medications, including insulin. It can ultimately help lower the personal and societal costs associated with type 2 diabetes. We're talking in the hundreds of billions of dollars type 2 diabetes costs us annually as a country. Although further studies are needed to evaluate the low-carb, high-fat diet's long-term efficacy and effects on heart health, our results add to the growing evidence that a low-carb, high-fat diet in motivated patients may be a practical and effective method to improve glycemic control with several additional metabolic benefits and should be considered as a viable treatment option in the management of type 2 diabetes. Once again, that was in the British Medical Journal, you guys. If you're not reading the British Medical Journal, they're really the ones that are leading the forefront of keeping the science there and keeping the bias out of it. But there is the study, Effects of the Low Carbohydrate, High Fat Diet on Glycemic Control and Body Weight in Patients with Type 2 Diabetes, experience from a community-based cohort. drc.bmj.com is the website, or probably if you go to bmj.com, you could probably find it that way. But two fascinating studies, guys, looking at and confirming that ketogenic diets really are best for type 2 diabetes. What's so funny, when I do these Jimmy rants on things that we already know, people look at that and go, well, duh, of course we know that. Well, we know that, but it's huge, and you have to acknowledge the hugeness of it, guys. It's huge when it shows up in clinical research, when it shows up in medical journals. The Virta Health study was in the Journal of the Endocrine Society. This other one was in the British Medical Journal. These are prestigious journals that medical doctors eventually will be exposed to. So yes, we know this already, but that doesn't discount that this is very, very big news. All right, let's see what you guys have to say. Gonna pop over here to my Instagram page first, then to Facebook, then to YouTube. Thank you all for being here today. JimmyRants.com is the website. See what you have to say about this one. Kat says the problem with nutritional and lifestyle approach is that the vast majority still want a pill. That's true, Kat. Unfortunately, we do live in that society where people are like, okay, that's too much work to cut my carbs. Can't you just give me a medication that will let me keep eating the way I already eat? And that's part of the problem. I think we need to educate patients better that taking a medication to cover up the effects of your bad habits in your diet and your lifestyle, taking a medication is not the same as changing your diet and lifestyle. That's the problem. There's an equivalency in the minds of people that, well, if I take this pill, it's just like I do these changes. No. And we need to communicate that a lot more clearly. Not our audience here, we are still in the minority, but how do you help someone's unwillingness? I think that's the big one. I think it's incumbent on the doctors to say, hey, look, I could put you on this drug and you're gonna have these potential side effects from this drug, da 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 da. And the drug will only provide up to this little bit of a benefit and really not much else. And you might get diabetes, you might get cancer later. There's a small risk of those things. Or you can change your diet. You can start sleeping better. You can de-stress your life. You can get sun more. You can move your body a little bit, blah, 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 just like they instructed in this study. And you could see not just all those benefits from that drug, but far greater benefits that will help you live longer. That's how you pitch it to people. Right now, there's an equivalency in people's minds, and you've got to tell them and demonstrate to them that it's not the same to take a pill as compared to changing your lifestyle. Frugal Mom says, but if you get off insulin, where will they get their money? Well, they'll make up money some other way. And in my mind, healthcare should not be about money. Yes, I said that out loud. Right now, healthcare is such a big business. Why do you think so many hospitals are a little bit eager to have COVID patients? There's money involved. I get it. There's some hospitals that are overrun and they don't want any more. But there's some that they're dying to have a COVID patient because they know they get a crap load of money. And there's a lot of medical doctors, especially surgeons, that are doing very, very well because of all the procedures that they do. And so it's unfortunate that hospitals have become like a big money-making enterprise. To me, I think we need to have hospitals be something that would be at cost. Maybe somehow you pay the doctors and nurses and all the people that work the hospital very well and make sure they're taken care of. But the actual procedures, make them at cost. So you keep the cost low and you de-incentivize them from doing so many procedures, so it's not about money anymore. But you're right, insulin, getting people off their insulin does not pay for those yachts or those trips or whatever else they go on. Kat says, I have type 2 in my life, drinking Coca-Cola with a Twix bar, saying that their diabetes is all good now with just taking 8 pills a day. Wow. She also endangers her grandkids, not our family. Wow. That's tough, Kat. And then you know what's going to happen. She's going to get progressively worse and worse and worse. And it's not anything more than if she just got rid of the Coke and the Twix bars. I know it's frustrating for you. Joshua says not losing fingers and toes in the future is pretty good benefit. Yeah, Joshua, it is. It really is. All right, guys, thank you for all those great comments over here on Instagram. Let me pop over here to my Facebook page. We're quickly running out of time, so let me try to get to you guys as quickly as possible. Welcome, guys. Thanks for being here. Kira says, do you know if there are any studies I can join to help promote the keto diet? I'd be willing to help out with metrics and data. I don't have any specific. I know there's a bunch behind the scenes that are being worked on. You could do like the, clinicalstudies.gov. You could see what studies are out there that people are working on, and you could reach out to the lead researcher to see if they would take on your help. So I don't know any specific ones, but clinicalstudies.gov, just Google clinical studies if you can't find it that way and see if they're out there. Christine says, definitely feeling better with my Hashimoto's and Graves' disease, both of those autoimmune, on a very low carb diet with intermittent fasting, but I have to intermittent fast for it to benefit me. Had metabolic syndrome and pre-diabetes, but no more. That is awesome. And yes, the 1-2 punch of a keto diet and fasting, intermittent fasting, is helpful. And the fun part is most people, when they go on a ketogenic diet, they spontaneously start intermittent fasting. So I'm glad to hear it's working for you. Mike said, my A1C was 6, now 2 years keto and taking ketones, 4.5. And that's perfect. That's what you want. That's what you're looking for when you're trying to control your diabetes. 4.5 is hardcore, dude. That's That's awesome. Mine's 4.9, so I bow to your excellence there. All right, thank you, Facebook. Gonna pop over now to my YouTube channel, see what you guys have to say about this one. Why can't people be more logical and open their eyes to see this? This is great news, says Keto on a Budget. Well, they're not getting it from the mainstream media. So that's part of the challenge, is media controls the message. And so they're not putting it out there. How are people going to hear? How can people get excited about what they don't know? It's totally sustainable. It's my lifestyle, to the point where I'm rarely tempted by sugars and grains. That's where everybody's trying to get. Gauze Keto says, don't want to hear this. More meat for us. Exactly. Harp C says, it's so hard to deny this obvious success. Exactly. Gary Taubes back in early 2000s was ridiculed, and remember the battles they went through those early years. You guys were all right. I've been keto 19 years and it works. Yeah, I've been out there since Gary. Well, Gary was slightly before me, but yeah, we've been in the trenches trying to teach this. It's kind of gratifying now, all these years later. Gary and I used to attend those conferences, and yeah, after a while, Gary just started banging his head at the wall going, wow, what's it gonna take to change? And what's funny is about the time he started getting exasperated over all this is when change started to take place. So that was really interesting. I know he's very happy that things have looked up on the horizon here. So, all right, guys. Well, thank you for being here today, and I love bringing you good news. And this is very good news. We had 2 new studies showing the efficacy of a low-carb diet, ketogenic diet for type 2 diabetes. One of them was 3.5 years, you guys, and we're still looking. It's going to go all the way to 5 years. So by the year 2022, we're going to have a 5-year study done of a ketogenic diet for the efficacy of controlling type 2 diabetes. That's going to be huge. It's already huge now with what they've done, but 5 years, that's unprecedented. Nobody's ever gone 5 years with any nutritional study like this. So it's great, and I love it, and we need to keep seeing that. And I'm gonna keep encouraging you by bringing this kind of research to your attention, because we all need to be encouraged that what we're doing is a very good thing. That's it for this episode of Jimmy Rants. JimmyRants.com is the website, and as always, you can engage live in the content. You got to go follow me right here on Instagram. I'm at Living Low Carb Man, LIVINLOWCARBMAN. Once you're there, engage live Monday through Friday, 11 a.m. Eastern Time, right here for Jimmy Rants. We also simulcast live over here on my Facebook page, so thank you guys for being here today. We also simulcast on my YouTube channel, the live stream. Thank you guys for being here as well. My whole family here today on Jimmy Rants. If you missed the live, you can watch it on replay on IGTV, right here on Instagram. We also put the past episodes up over at YouTube. Type in a keyword Jimmy Rants, or go to youtube.com/Living La Vida Low Carb, or Living Low Carb Man. I'll get it right in a minute. youtube.com/Living Low Carb Man, that one. And then finally, we have an official website for this show, JimmyRants.com. And once you're there, click on the Patreon page. If you like what you see here, definitely go and support the work that I do. Any donation of any amount would be greatly appreciated. All right, guys, that's it for now. We'll be back real soon with more Jimmy Rants. And so until next time, we'll see you then. All right. No, I got tongue-tied there at the end. It happens. I slept good last night, so it's not because I'm tired. Maybe it's I'm hungry. I did have a ribeye steak early today, like way early. I should not be hungry. I don't know. Brain farts, I guess is what they call it. So, all right, guys, let me pop off of here for now. I've got some people coming to the house to look at my generator out back, and I told them call after noon, so it's just now noon. So, knowing them, they'll probably call within the next couple of minutes. So, nothing better than a ribeye for breakfast. Exactly. I actually pan-seared it this morning too. Usually I grill them on the grill, and I love the taste of a grilled ribeye, but I decided to pan-sear it and then like take the juices and like pour it over the top and kind of crisp it up. It turned out pretty good. Still not as good as a grilled though. I'll eat a grilled steak all day, every day. Can you adopt me? No. If you take care of my chickens, maybe. All right, guys, let me pop off here. Thanks. Talk to you later. Bye. Bye, YouTube.